Dr. Winkler, let's talk about chelation therapy. Can you talk a little bit about that is, and what are some of the ways you go about that?
Well, chelation therapy is a type of therapy that we use to pull heavy metals out of the body. There's a couple of different types of agents you can use. The most common one is EDTA, and that is the one that has been initially developed to pull lead out of the body, but it's found to pull out other heavy metals. And chelating means to bind, it's a grabbing agent. And there's a way to do it intravenously and then have the kidneys, then essentially the toxins are pulled out of the tissue, they're brought into the kidney puts it in the urine and it's excreted from the body. And we can actually measure that. We'll do 6-hour urine collections after the first chelation challenge. And we'll also, if we're looking for mercury or suspicious for mercury, we'll use DMPS as a chelating agent. And so EDTA and DMPS are intravenous. There are some oral, or sometimes people will use rectal EDTA. And there's a third agent we would use, which is an oral agent, is DMSA. And that's one you can take as oral tablet 3 times a week, and that will pull mercury out. There's another protocol that we like to use that I think actually pulls out more metals, is to use the PK protocol. That's a protocol of using not so much chelating agents, but things that actually do push metal out of the body. And that would be through using phenylbutyrate, phosphatidylcholine, leucovorin, and glutathione. And if done in the right sequence, you can actually pull out a lot of heavy metals out of the body, and we've actually watched and seen that in several patients. So,
if there's a lot of over-the-counter things that people can buy to detox, when you talk about getting heavy metals out of the body, is there a danger in doing that too fast and getting too much out at one time?
Well, I think with the oral agents, that is probably not that different, not likely to occur.
Okay.
I think people use cholera, they'll use other types of natural things, algae or other types of ingredients that you can use to actually pull the metals out. We've used one before called Metalliclear. That's a product made by Metagenics that will actually pull mercury out. We actually tested that on a few people at higher dosages than usual. Those types of agents, you don't need to worry too much about pulling the metals out. I don't think they pull them out very quickly. If you use DMPS, we would supplement with some extra zinc and selenium, because actually if you think about it, where mercury binds to is actually where zinc and selenium would otherwise bind to.
Okay.
So when you pull that out, you need to replenish the zinc and the selenium.
Okay.
So that would be a concern there.